Hello and welcome to this week's What Were They Thinking? First is the official declaration about the Johnson & Johnson's unexpected blood clot side effect. Then news about volunteers who want to be reinfected with the CCP virus. Relationships between cannabis and psychosis, yet more success with Ingenuity on Mars. The timestamps for these and other news items can be found in the description box below. Let's start with the European Union's official stance on the Johnson & Johnson vaccine. The Johnson & Johnson vaccine has been known in recent weeks to produce blood clots. These blood clots are now officially described as very rare. This is an important observation. A number of countries have suspended the distribution and use of that vaccine because of the possible risks of the blood clots causing death. The fact that the exact numbers and relationship was unknown was a concern. The reality is that between the incidence of blood clots with the CCP virus in its own right and the incidence from the vaccine had the upper hand by being far rarer and less of an issue as it could be dealt with. You could predict to some extent when it would happen and why it would happen if you were subject to the vaccine. This means that you could actually have someone in the hospital and get them dealt with immediately, rather than having a spontaneous clot develop from the CCP virus. This hasn't really adversely affected the Johnson & Johnson vaccine. The regulator has simply said that the vaccine must now come with a warning that indicates that it could cause unusual blood clots and low blood platelet levels. Since the clotting side effect is predominantly affecting those who are younger, countries that have been subject to this new effect, effectively everyone on mainland Europe, they are now going to look at prioritizing it for those who are over 60. That makes sense. They're the group that are both at most risk of the CCP virus and least likely to develop this side effect. The Johnson & Johnson vaccine has certain benefits over the other vaccines that are available as well, and this is one reason why the news coming out for it now is actually quite good. It only requires a single dose, and its storage and transport requirements are far more lenient than any of the other competition. This means it can be sent to more places more easily, and more people can be treated with the doses available in each shipment. The benefits of vaccinations can't be underestimated, and right now Israel is demonstrating that better than every other country in the world. They now have the majority of its population vaccinated to the CCP virus. As a consequence, many of the otherwise restrictive practices that were there to help bring the bell curve down and allow medical facilities to keep pace with the infection are no longer required. Things like requiring a mask, some of the social distancing requirements, and so on. It is essentially a return to normality, or at least a return to normality on the outside. The public is still required to wear masks in indoor spaces, and to a degree this makes sense. There's a much higher risk of infection from an indoor location than outside, and with only half the population vaccinated, there's still a risk for both that other half infecting each other and keeping the disease in a reservoir in the population. It only takes a small percentage to keep it going for quite a while. Most countries are aiming for a 90 to 95% vaccination rate, ideally even higher, but that's accepted as the minimum threshold. At the moment, 56% of the Israelis have had both doses, or one dose of the required vaccine, and 60% have had at least the first dose of the vaccines that are being distributed. Where Israel is seeing a return to normality, America is yet again leading the way in a less desirable manner. They've experienced several what are called breakthrough infections. Breakthrough infections are infections that occur in someone despite having been vaccinated. This is not exactly a surprise, but it's not good either. No vaccine is ever going to give everyone 100% immunity. It's simply not possible with the way the immune system is and all the pathologies that are out there. Any kind of pathogen that gets into your body will have some sort of way to try and avoid the immune system, and not everybody's immune system can pick up on everything. This is why some people have a more extreme reaction to a vaccine, and others have almost no reaction. Despite those two extremes, the degree of immunity garnered from that vaccination can vary just as much. This breakthrough infection is very similar to what we observe with influenza. The infection, although occurring, was nowhere near as severe as it would be in someone who wasn't vaccinated. And this is similar to what we see with the influenza vaccine. Not everybody garners full immunity, but those who have some immunity have substantially less severe infections. The good news from this study is that one of the women who was infected was 65 years old and is in the age group at greatest risk for severe infection. They had received their test, and this was more than 2 weeks after getting the second dose of the vaccine. It appears to demonstrate that, as with the clinical studies and other research, receiving the vaccine drastically reduces the severity of infection amongst those who are most likely to experience severe side effects and symptoms. The concern with at least one of the patients is that they appear to have been infected by a hybrid of both the UK and New York variants. It is possible that they were infected by both strains simultaneously and it underwent some sort of recombination. Alternatively, it could be some sort of convergent evolution, where this virus has mutated and developed the same features as these other two strains because they are both beneficial. The American case studies, if you want to call them that, are one thing, but in the UK, they're looking at something similar but decidedly different. They're recruiting volunteers to be reinfected with the CCP virus to understand what the immune response is. Yes, they have people who are willing to be reinfected with what could be a life-threatening disease, and they are getting these volunteers. If the individuals begin to suffer symptoms from this reinfection, they will be given treatment to try and mitigate it. The idea behind this is to figure out whether or not you have protection from prior infection and what factors play into being protected either from vaccines or infection, as the two should be relatively similar. It will involve a very small cohort of only 64 individuals aged between 18 and 30. Another important finding from this study will be just what sort of dose is required for the virus to begin replicating without symptoms in some of the cohort. The other half will receive the established dose that's needed for that to happen. In news related to the CCP virus, but not directly the CCP virus issue, we have a chiropractor being charged in St. Louis County after claiming that their supplement product full of vitamin D and zinc was scientifically proven to treat or prevent the CCP virus. Considering how much work and hassle went into creating vaccines, you can imagine that these claims are, at best, stretching the truth, and at worst, complete fallacies. And that's exactly how regulators have looked at it. The chiropractor is in a lot of trouble and being charged because what they said simply isn't true. They may be convicted of up to 10 counts in federal court. These charges come from a relatively new piece of legislation. It's intended to protect people from false claims and it's called the COVID-19 Consumer Protection Act. And it's run by the Federal Trade Commission, or at least it's under the Federal Trade Commission. Over the last year, this chiropractor has made various claims. This includes drinking about 100 milliliters of tonic water and having 100 milligrams of zinc in order to prevent, and this is his word, prevent COVID-19 infection. That's a pretty bold claim. It would appear that he wasn't overly confident in this though, as in under a year he's already started to backtrack saying, "I've never made one claim at all that any of these nutrient cures or prevents coronavirus." As the FTC alleges, they sold both zinc and vitamin D in a product called Wellness Warrior, with claims that it was as effective or more than vaccines. Yeah, they're quite bold in what they're saying for somebody who has their entire business built on the notion of a dead guy spoke to someone claiming that they knew from someone else how to cure everybody's ailments. Unfortunately, the punishments for this are relatively limited. It's approximately $43,000 for each violation that they're convicted of, meaning by the time this comes to the end, it would be about $430,000 in penalties. Going now from one supplement to another drug, let's say, cannabis. Cannabis is somewhat controversial. Its use will vary state by state and country by country. Different states and countries view it differently. The Netherlands, for instance, has it more or less legalized. Parts of America are following suit. The issue has been the psychological and psychiatric side effects of using it, both acute and long-term. There has been arguments that its use at certain age groups can be adverse to well-being. That is, if you use it on a large enough scale when you're younger, it could affect your mind, whereas when you're older, that effect is significantly reduced. That's where this study comes in. It was trying to figure out whether or not cannabis was associated with schizophrenia, and could there be something in there that meant people were more or less prone to developing psychosis as a result. It is argued at times that cannabis use comes before psychiatric illness, and in other cases it comes after psychiatric illness. Sometimes it's argued that use itself is driven by illness, and in other cases that the use drives the illness. When looking at larger scale studies, it's indicative that it's often the use that is more closely associated with leading to psychosis, rather than psychosis or schizophrenics using it. This, even once you start accounting for medication and personalities, is still true. Despite that, it's a tiny fraction of individuals who do eventually have psychosis due to cannabis use. And although it's a tiny fraction, if cannabis use becomes more popular and accessible due to relaxation of various laws, knowing what would lead an individual to be more prone to mental illness because of their use is important. The study from the UK looked at available data from the UK Biobank. This is a genetics library. They also had access to information on cannabis use and psychiatric issues. 4% of those with no cannabis use had a corollary with hallucinatory experiences. That increased to 7% for those who use cannabis, but there was also a close association with schizophrenia. It was about 60%, and on the low end, it was 40%. This is a pretty big relationship, and understanding if there's some sort of crossover would help a lot in not only supporting people, but possibly long-term development of more suitable drugs. Going now to completely unrelated news. NASA has selected SpaceX to take astronauts back to the moon for the first time since 1972. This is a contract that's nearly $3 billion in value, and it's going to use the Starship spacecraft that's been tested recently by SpaceX. It's the same craft that has had a number of issues so far, but hopefully by the time they get to actually launching astronauts to go to the moon again, they'll have ironed those out. This will be the first step towards creating a sort of space base on the moon. It will involve having astronauts go there for roughly a week, and SpaceX will be well positioned to do so, as they're currently working towards building their much larger delivery mechanism. That is their super heavy rocket. This, in combination with the stated goals of America to try and get back to the moon and then further on in the next few years, we might actually see this happening. While Musk plans to try and colonize Mars, we're still struggling with rovers and similar, at least as far as getting them to work in the long term. NASA has recently managed to deploy their Ingenuity helicopter. This was meant to be able to take better images and survey things from the air. Mars is a much more difficult environment to do this on, primarily because it lacks an atmosphere. This means it's harder to get the necessary air resistance to lift something off of the ground. Ingenuity has managed to overcome most of these hurdles and has now conducted 2 flights. One to simply raise itself up off the ground and manage to get 3 meters. The second has been now to move itself left and right. To give some context, in order to be able to lift itself up just those 5 meters for the second time, it had to spin its rotors 5 times faster than an equivalent helicopter on Earth would have to do. This is what gives it enough traction. Considering that itself is quite an achievement, spinning that fast under the limited atmosphere is incredibly difficult. Ingenuity is only expected to be able to survive roughly 2 weeks in the Martian environment. Not only that, but to complete a maximum of about 5 flights. The 3 remaining flights are expected to push Ingenuity further and further, and in all likelihood with the final flight absolutely destroying it. The advantage with this sort of craft over rovers is that it can access areas completely inaccessible. Caves, canyons, mountains, and rough terrain. Areas where the rovers simply can't travel because of their limited capacity. Those are all the news items we have for you this week. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below